Okay, everyone, I'm going to get started now. So let me just get up the presentation. Make sure I'm sharing my screen first of all. Okay, you should be able to see that now. Perfect, we'll get going. So let me just double check if anyone's having any issues. Don't think so. Okay, so welcome to the webinar. What do you need to know as a female athlete? For anyone that I haven't met, my name is Carl, and you probably more than likely found this webinar through my Instagram, Stick to the Plan, or someone might have shared the link with you either as well. So before we kind of get into things, just give you a bit of background on myself. I graduated back in 2019 from AIT with a degree in sports science with exercise physiology. I started coaching different kind of underage teams through S&C and kind of skills in around about kind of probably 2016, 17 time through experience with my degree and kind of coursework then as well. So the coaching that I've done and performance analysis, which is kind of recording stats for different teams and seeing how to improve performance on that side of things. Has been between Westmead LGFA, which was my placement in college, also my local club Longwood LGFA and the GA, both the women's and the men's side. Same in the trim, women's and men's side. Then bit of performance analysis with Ballyboden ladies, also Wexford underage teams, and also Offaly underage teams, and also in person on the floor personal training. And I've started online personal training through Stick to the Plan in around about May of last year. So how Stick to the Plan came about? I was diagnosed with cancer in 2021, and I finished treatment that same year, April of that same year. And throughout my whole kind of treatment and also my recovery, the motto, I suppose, or the affirmation, for want of a better word, was stick to the plan. So stick to my treatment plan, stick to whatever I needed to do, and come out the other side. The original motto came from sitting at the kitchen table, and it was taking about 3 or 4 hours for me to do my homework, and mom would politely say to me, stick to the plan. She might have thrown a curse word in the middle of that as well. So I took that out and just went with stick to the plan. And I wanted to start coaching people using my own personal experience and obviously both my kind of professional experience as well, to help train people and get people the results they need, whether about rehab and injury, improving their mental and physical health, through a bit more of an holistic and educational approach rather than kind of most of the things that you see online these days. So to get into the actual webinar now, the different stages of the menstrual cycle. So the cycle can actually range from about 25 or 26 days all the way up to around about 34 or 35 days. This is completely dependent on the person, your genetics, all that kind of thing. There's no kind of set, you will be a certain day. It could even change from month to month by a day or two. But the way we're going to work this and what all the research is uses is a 28-day cycle. So for the purpose of this, just to keep it simple and simplicity's sake, for especially describing the different phases and that, we're going to go to a 28-day cycle. It's usually right bang in the middle of the end range, or the two end ranges of people's cycles. So menses, which is the actual kind of loss of blood, happens for about 4 or 5 days. Again, this can be shorter, it can be a little bit longer, depending on the person. Again, this comes down to genetics and your own kind of body and the way it works. The follicular phase coincides with this. So this is both menses is from day 1 to 4 or 5. Follicular is day 1 to about day 14. Again, just for the example that we're using, we're going to use the 28 days. So the first half is follicular phase. It's 1 to 14. On day 14, ovulation happens. So this is when the egg is released, ready to be fertilized. And then after that, the luteal phase, which is kind of the whole process of kind of getting rid of the egg if it hasn't been fertilized. That happens from day 14 to 28. So that's kind of the breakdown of the stages. I'm going to go into the biochemistry, or how all the hormones kind of work. If you can hear a baby screaming, it's my own daughter in the room next door. So she'll probably give out if I am saying anything wrong, or maybe in a few years. I don't know when she looks back on this. So just before, if anyone didn't know, menses, or the actual kind of release of the blood, is actually the start of your cycle. It's not the end, and that was I I didn't realize that, especially when I got back in, or when I started with the Westmead ladies football. So it's kind of eye opening. So not everyone might be aware of that. So that's a good thing to know before we get going, or we go into the next slide. So this next slide goes through the kind of levels of the main hormones throughout the different phases. So hopefully you'll be able to see my mouse, so it'll be a bit easier to follow as I'm explaining. So menstruation, which is actual kind of bleeding, is day 1 to about, as I said, day 4 or 5, and this coincides with the follicular phase from day 1 to about 14. So I am going to explain the kind of the increase in strength and how to train around the stages in the next few slides. But just to give you a general idea before we start. So in this first phase here is where girls and women usually feel the best. So what I mean by that is your strength. This is during your whole cycle or the whole month. This is where you're at your strongest. You're probably at your leanest, and I'll get into kind of body weight and stuff in that in a second. Probably around kind of your leanest, you're feeling your best, you're in kind of a good mood, and I will get into psychological effects throughout the month as well. You're in kind of your best moods, and kind of, yeah, you're generally feeling good about yourself. Then ovulation obviously occurs, so this changes the whole kind of levels and uh, which are the dominant hormones that are kind of flooding through your body. So as you can see up this line is where estrogen is a sharp spike in estrogen. It kind of slowly climbs up, and then all of a sudden it kind of sharply rises there. So this is where you get all your strength gains, and I'll get into that in more detail in a second. Then it sharply drops off. There's another little spike in the luteal phase, but the main kind of strength that you'll have is around the day kind of 10 to 14 mark. The follicle stimulating hormone, which stimulates the ovaries to release the ovum. That's obviously, you can see that sharp rise here. That's obviously coincides with the egg or ovum being released. Then luteinizing hormone is kind of tricky enough to see in this with the different shades. But again, you kind of see the rise and fall in that. It's not really, obviously it does affect things, but not as much as estrogen and progesterone. So as you can see in progesterone in the yellow, that has a sharp increase here as estrogen comes down. So around the end of the, sorry, I clicked forward there, around the end of the luteal phase is where kind of injuries most commonly occur, where women and girls feel the worst. And what I mean by feel the worst, both psychologically and physically. So this is where your strength sharply decreases with the increase in progesterone. And yeah, I'll get into that into the next few slides. But usually day 1 to 14 is where you'll feel best. This is where you'll make kind of all your improvements. And day 14 to around about day 28 is where you'll kind of be looking to maintain what improvements you made, or you might see a little bit of dip in performance. And when I say performance, that's also on the pitch if you're an athlete, but also if you're kind of just the general gym goer, it means your weights will be reduced, or the amount of weight you can lift will be slightly reduced. Might be reduced reps and kind of intensity. If you're a runner, you might not be able to run as fast or as hard as usual. So that's what I mean by kind of performance, just so everyone's on the same page with the definitions. So, how hormones affect training and exercise. So, as I said, strength increases during follicular phase. This is the first stage. So, for simplicity's sake, again, we'll just go with the 28-day cycle. Obviously, you'll have your apps flow, which is one I know just from Leah having it. You can kind of track this, and it'll tell you kind of a really good estimate of where you are along your cycle. So your strength will increase here. So this is where you'll feel the best. As I say, you'll be able to lift the heavier weights. You'll be able to go for PBs. You'll be able to kind of run faster. Kind of your whole kind of performance, if you're on the pitch, will increase. Uh, Usually around this phase. Then your endurance, research has shown your endurance increases during the luteal phase. So that's the second half of the cycle. So research has kind of shown, and I have references at the very end of the slides, just so you know where I got my information from, or to back up kind of what I'm saying. Your endurance increases, so you're able to kind of run for longer, but it's at a reduced intensity. So if you, I know running is big at the minute, so I'll use that example. So you'll be able to run, say, instead of doing a 10K, you'll be able to run kind of a 12K, but it'll be at a lower pace, be able to run for longer, a longer distance, if that makes sense. Hopefully it does. Then there's an increase in risk of injury pre-menses, and I'll get onto how the anatomy works as well. So pre-menses is the end of the luteal phase. So as you hit ovulation, which is obviously you can see in the next point there, your ligaments soften due to the different or the increase in progesterone and the decrease in estrogen. So if you what everyone's kind of familiar with is testosterone in men. So people take steroids, which is usually testosterone, and this increases your strength. It stiffens your ligaments, stiffens your tendons. So, as testosterone is for men, estrogen is the same for women. So, if you have a higher estrogen level, means you'd be overall stronger, your ligaments will be stronger, your tendons will be stronger, your bones are going to be stronger. As estrogen decreases in the second half of the cycle, you're at an increased risk of injury because you're not as kind of resistant to the load that's being put through your body. So take it if you're on the pitch and you kind of do a sharp turn, or your studs gets caught in the grass, or the astro even is usually where people do their ACLs. You're at an increased risk of injury happening. That doesn't mean always, because that mean every single week somebody would do their ACL. It's just your risk of injury increase. Doesn't mean injury will happen every time you go into the second half of your cycle. The added kind of, and I'll kind of focus on ACLs in a minute. So the ACL, for anyone that doesn't know, is the one of two ligaments in the middle of your knee, and it basically connects your thigh bone and your shin bone together. And if that breaks or snaps, or you injure that, it's usually between kind of 6 months and a year recovery and rehab to get back onto the pitch. So the athletes that are listening to this will probably be aware of that. Anyways, it's the kind of most common serious injury in female athletes. So the way the anatomy of the hips affects your knees is a thing called the Q angle. So the Q angle is basically the angle from your hip bone to your knee bone. So if you think the wider your hips and the closer your knees are together, there's more of a sharp angle kind of down your leg, and that'll throw your knees together. So what you kind of don't want to happen in excess is your knees to sharply come together, especially when you're kind of landing from a jump or turning when you're running or sprinting. That puts increased load through the middle of your knee and also the inside of your knee. And this is usually how ACLs and the ligaments on the inside of your knee, how they get damaged. And again, with the softer ligaments during the later stages of a cycle, it increases your chance of that type of injury happening. I will go through how to kind of reduce that risk again in the next few slides. So hopefully you're all still with me at the minute. The What I think from firsthand experience from training female athletes and also female clients in the gym is the actual pain of the cramps. I think it's a bit underestimated in terms of your ability to exercise. So if you're like 10 out of 10, you feel faint, you're getting sick from the pain of them, you feel drained and tired, you can't actually do your training session, or you can't play the match, or you can't go to the gym, you can't go out for the walk, whatever your mode of exercise is. So again, not the different hormones and the way that works is obviously your uh, kind of abs are tightening, releasing all the kind of tissue you're not in control of is basically doing things, not doing things, but contracting, releasing, all of that kind of stuff to get the egg to where it needs to be. And obviously the pain, as I told you from first hand, is kind of underestimated in by the coach's point of view and perspective. I don't think it's taken into consideration enough, especially like during training sessions. Sometimes girls get into a training session is enough for them, and is like enough of a win to actually be at the training session than miss out. So that's kind of the general gist of how the hormones affect training and exercise. The next one that I'm going, so that was kind of the physiological effects. I'll go on to a couple of the psychological effects, and this usually occurs during the late luteal phase or pre-menstruation, so just before the bleeding happens. So research has shown, and usually, obviously, everyone's aware of the kind of social, how do you say, stereotype that women go crazy at certain times of the month. And as much as it is annoying, it is true. Um, Sorry to be the bearer of bad news there, but you do, and not bad news, I suppose, but actually validate your thoughts and feelings of kind of higher levels of anxiety and different kind of symptoms in that, which I'll get into now in a second. So research has shown there's less perceived control of anxiety around this stage. So meaning you might feel the same level of anxiety on your day 10 of your cycle, and you're better able to cope with that anxiety. But on day, say, 20, just for example, you might have the same amount, but your ability to cope with that is lessened due to your different hormones and stuff like that. The main one is progesterone. So with the increase in progesterone, meaning this gets converted into cortisol, and everyone I hope knows cortisol is the kind of body's main stress hormone. So if you increase stress, increase kind of everything across the body. So it'd be inflammation, it'd be decreased time of recovery from an injury or a training session. Again, the psychological side effects of it, of anxiety, increase in symptoms of kind of depression, and as you can see there, psychosis and schizophrenia. Now, that is in people that have been clinically diagnosed with psychosis and schizophrenia. It doesn't mean that you're suddenly schizophrenic at the end of your cycle. It just, the point I'm getting across, that during this stage, it can have psychological effects, and in people with these clinical conditions, it worsens their condition or symptoms, if that makes sense. So I already kind of went through the increase in cortisol from the increase in progesterone. It's because progesterone is converted into cortisol, and with the raised levels, increases your overall levels of anxiety, inflammation, and everything else that comes with being stressed. So like brain fog, being disorganized, all of that kind of thing. So again, from a coach's point of view, I think widely uh, the wide point of view that I've seen from talking and going to different coaching conferences and workshops and different things like that, the psychological effects need to be kind of brought up more into the conversation. I think everyone's starting to get a grasp of the physiological effects. So your increased fatigue, increased risk of injury, all of that is kind of getting into the sphere and the kind of the talk around female athletes and coaching female clients and athletes, obviously. So red flags to watch out for would be irregular menstruation. So this would be having your period for a month or two, then it disappears for a month, then back for a month, away for 2 months, back for a month, but it's kind of a shorter cycle. Then the next month, it's a longer cycle. If there's no real pattern to it now, as I said at the very top of the presentation or the webinar, your cycle 1 month might be 28 days, for example. The next month it might be 29. Next month it might be 27, so on and so forth. That's not irregular. Irregular if it swings from 24, then the next month it's 35, then the next month it doesn't happen, then the next month is 28. That would be kind of classed as irregular. Then kind of to further on again, menstruation stopping entirely, which is called amenorrhea, and menorrhagia is, I hope I'm pronouncing it right. You can blast me in the comments or the emails after this if I'm not pronouncing these right. Is painful periods, so like excessively painful periods, and like I said, the pain from cramps and actual menstruation I think is a bit underestimated, and people are clinically kind of diagnosed with this condition, which further kind of has further side effects and can cause further problems for training and trying to increase your activity and exercise, and also your enjoyment of the exercise as well. So excessive increased fatigue during menstruation. So you, what research, what I've seen in the research is around 20 to 60 mils of blood is lost, but this can also be up to over 200 mils. So if you cut your finger and you lost 200 mils of blood, you'd be worried. But I think people underestimate just, oh, it's my period, there's loads of blood. People kind of just throw it away, and it's not, it's like, oh, that doesn't affect me. But if you lost 200 mils from your finger, you'd be kind of probably going to the hospital or going to a doctor. So to follow up with that, there is a risk of anemia. So if you do have a particularly heavy flow, taking iron supplements, or at least speaking to your GP about kind of taking iron supplements, or kind of investigating further with the right healthcare professional. Again, my lane isn't to diagnose people with conditions or to treat those conditions. It's to work around the conditions, is my lane. And if you're working with another coach, which I'll get onto as to what you should expect from coaches, just because I'm on the topic now. Yeah, you should stay. They should stay in your lane, in their lane, and tell you to go to the right person. So yeah, that might be if you have a particularly heavy flow and you have excessive fatigue, means you're low on iron, which means your body can't carry enough oxygen to get around, which makes you feel tired all the time. The next one is unintentionally losing weight. And to get into the kind of nitty gritty of this, the muscle mass versus body fat. So obviously intentionally losing body fat, that's completely normal, completely fine. Obviously, if it's in a sustained and controlled manner and you're not doing excessive exercise or excessive calorie restriction, which can, if you do one or the other or both of them in excess, it means your menstruation stops entirely. Why is this important? Is your body is meant to be healthy enough to carry a child. People, I think, get confused with this as you should have children, or at some point in life you should have children, and the only purpose of women is to have children. That's obviously not true. We're in 2024, and if anyone tells you otherwise, you say whatever you want to them. I'm not going to suggest that. So if your body isn't, it's basically a big, huge red flag that if your body isn't capable of being able to carry a child, or an egg being fertilized, it means something's seriously wrong in terms of there's too much stress on your body from too much training and playing too many matches and not giving your body enough fuel to be able to do all the activity and stuff. This can also happen from stress from school, work, life stressors, where menstruation stops and your body's kind of gone into a state of shock and kind of fight or flight mode, being like, we just need to get through this kind of period of stress and then we'd be able to bring a child into the world. So that's why It's a very important point. If that's happening, that your menstruation is stopping for any other reason than it, like a clinic, you've been clinically diagnosed with, a side effect of a medical treatment, or a condition. If you haven't been clinically diagnosed with that, it's important to go to your GP, or a doctor or a nurse, and be referred onwards if you need referring onwards, or your GP will be able to help you there. Then actually I want to go on to one point about the weight. So I'll go back to our phases. So what I want people to know is around the end of the luteal phase, which is the second half of your cycle, that's where most people get panicked about their weight. And what I mean by panicked about the weight is what you start saying, oh, I'm after putting on a load of weight. I look terrible. Uh, we all know the words and statements and everything that come out of everyone, of your friends, family, whoever you might hear. The reason why everyone feels terrible around here is the increase in water retention. So progesterone and the kind of other little spikes in your follicle stimulating hormone increases the amount of water you retain. This means obviously that your body weight is higher, and it actually makes you look fuller. So to give an example of bodybuilding, um, bodybuilders will cut out carbs completely because carbs hold on to water. This makes them, you obviously you see all veiny, etc., etc. After you do that, or after they refeed and put food back into their body after a period of restriction, they feel fuller and they lose muscle definition. So they don't look as kind of ripped or lean, or whatever way you want to describe them. So if your body's increasing the amount of water around here, it's not actually kind of body fat or quote unquote bad weight. It's literally just water. So the way to measure, I'll go back to here. So the way to measure weight, and I'm not a big fan of measuring body weight because there's too many variables, especially with water, your water intake, what you've eaten, etc., etc. Is if you really do want to manage your weight, track your cycle for 2 or 3 months, know what weeks are what, especially, and make sure you're in a regular cycle for a couple of months. Measure your body weight from week 1 to the week 1 of the next month, week 2 of the first month, week 2 of the second month, because your body's in the same stages and the same kind of hormone levels from month to month. Whereas if you measure, I'll go back to the graph here. If you measure your body weight back and here, your levels of hormones are drastically different from day 1 to 10-ish, 10, 11, then day 15 to 28. And that people underestimate the kind of amount of water you can hold and the amount of weight you can hold within one day. People can fluctuate 5, 6, 7 pounds in one day alone, let alone over a course of all your hormones changing and increasing and decreasing as the month goes on. So hopefully that makes sense and I've explained that okay. So tips on how to manage training and exercise to obviously get the best results that you can, or kind of enjoy sport and training as much as you can. First of all, plan ahead so you can kind of track right from this week 1 of my cycle, or this date to this date is week 1 to 2 of my cycle. This is where I'll go really hard in the gym in terms of trying to get PBs, increasing the amount of weight you're lifting, or if you're kind of more endurance based, is increase the amount of mileage or the intensity that you're running at. Then on your week or your second half of your cycle, you can plan on, right, I won't train as frequently. I'll still train to the same intensity, which means you'll still lift heavy, but you won't do it as often. So it means your body still retains the gains that it's made in the first half of your cycle, and then when you get back into your week 1 and 2, you can kind of follow on and increase further or improve further on the gains that you made. So as I said, focus on making strength improvements during the follicular phase. which is back around here, just to give you. So again, your strength will increase with the rise in estrogen. So plan your kind of strength and power training around that, or your increase in load around that. So if you can plan ahead of your training sessions, being like, right, I'm going to do really well or put as much effort as I can in around this week, and then on week 2 or 3, being maybe tell your coach or whoever's training you, I'm feeling tired this week and next week or whatever it might be, and just maintain what you've already done and just keep the activity going. Where are we again? So yeah, tips. So as I said, focus on maintaining your drop in training load on men's this week. So again, with the loss of blood, you're losing iron, and obviously blood carries everything around your body. It's your energy sources, obviously all your hormones and all your nutrients. Have a realistic expectation of your improvements. Because all of this is going on in your body and also the effects on your mind, you're not going to have a linear or steady increase as the weeks go on. So literally, you're going to measure, just like if we take the measure in your body weight example, measure your improvements or your strengths or exercise, whatever your goal is, from week 1 to the next week 1 of your cycle. So this comes with a bit of collaboration with your coach. So again, if you're a coach, if you're in the just in a gym setting, or again online, if you're like the work, if you're working with the likes of myself or people similar, collaborate with them. You don't need to tell them all the ins and outs of your period or your cycle. You can just tell them, I'm feeling a bit weaker this week, or on these certain weeks, or this week of the month, can we just drop the training load? They should have the cop on to know what that means, or kind of be able to do it. And even if they don't pick up on what you're kind of trying to tell them, they should do it anyways, because you should have a bit of control in the way your training goes and how you plan around that. For the athlete kind of perspective, and what would happen during, especially in the Westmeath team, is the players might tell the manager, "Oh, I'm not going to make 2 training sessions this week. I'm just going to do the 1 training session on the Tuesday, but I'll definitely be there for the match," or vice versa. They'll be here for the match or the training sessions, won't play, maybe take a match off if they know that they're going to be in a lot of pain, and kind of they know their own body and the side effects that come with their own cycle. Again, I never knew, or we never kept track of people's cycles. I know in professional and elite sport, they will have people that track cycles, but obviously at the level that we're all playing at or coaching at or training at is not at that elite level. So you're not going to have that insight from kind of coaches, and it's people whose actual job it is to play sport or be an athlete or train kind of in that manner. But yeah, that could be a kind of strategy. Just tell your coach, or if you're doing your own coaching yourself or own plan yourself, like, right, that week I just won't go to the gym at all. I'll just take a complete rest week, and the week after menses, or a few days after menses, then right, I'll get back into the gym and kind of train that a little bit harder, and then take the next week or 2 off, or lower the load as we said before. So we're nearly there. What should coaches do, or what should players expect from coaches? Because we both have coaches that are on this webinar, and also obviously athletes that are playing under coaches. They should not give out about performance during training or during a match, regardless of a menstrual cycle, or if you're a woman, man, or indifferent. They should not give out about performance. If you are an athlete, or you're in the gym and you have a coach and they're telling you, come on, keep going, or push harder, give me 10 more of that, or we'll add more weight, and you know physically that you can't do that, or it'll take too much out of you, you need to get a new team, a new coach, or tell them otherwise what they're doing wrong. Because they should, realistically, they should know, kind of, to, even if they don't realize that it's because of your cycle or because of menses or whatever it might be, they should know to take it off or manage your minutes if you're, for example, a football player, or they should know that your own feedback being like, I cannot lift that weight or I can't do it for that many times, they should agree with you and not tell you to do any more that you're not capable of doing. Understand the training load and demands of sport. So this is where I have my gripe with coaches, especially in underage level, where they need to do preseason training and they've 14, 15-year-old girls doing sprints up and down the pitch relentlessly for 8, 9, 10 minutes at a time. I've seen all the horror stories, not horror stories, but in terms of you're looking at them like, God Almighty, you can see like 4 or 5 of them just cannot do it. And you can kind of guess they're not at the fitness level required to do that sort of training, and B, they're probably maybe at a certain stage in their cycle, especially towards the second half, where they shouldn't be doing that kind of intensity or training load. And this is where coaches kind of don't know how to stay in the role, or they should know their role and stay in their lane. If you are an athlete or you have been working with a coach for a while, you go, look, my cycle is a bit irregular at the minute. How do you think I could help? They should tell you, go to a GP. They, I'm not, even though I might know just from doing my own reading, I might know what you need to do. I'm never going to diagnose you. I'm never going to try and treat you or tell you to get certain medicine, eat a certain thing, or drink a certain amount of water, whatever it might be. And they should tell you go straight to a GP or to kind of the relevant person that they need, and kind of know their own limitations of what they should specialize in. So as I said at the very start, my role is not to, diagnose you with anything. It's literally to manage your training load and what you need to get what the results or the goals that you want to work towards. If you come to me and, as I said, say, I've had my period for 3 or 4 months, I'm gonna be like, you're stopping training. If you're just for amusing myself, an example, you're on a plan with me, your plan is stopped, paused. Once that comes back and you get that sorted from a GP, then you can get back on training with me, or we'll adapt your training. Once that's sorted, and kind of you give me an update. So that's the kind of level of collaboration and trust that you should have in your coach, even if you're online coaching, in-person PT, or you're with your club, football club, hockey club, whatever sport you might be playing with. So if that's not happening, you need to go to higher ups in your club, or you just need to fire your coach. And same goes for if I'm not doing that, if someone's working with me, I'd expect them to fire me or tell them I want my money back, or I don't want to keep working with you. So that's a kind of a big thing, or kind of not gripe, I suppose, or it really grinds my gears of coaches just blindly telling, especially kind of the underage groups, the kind of under 12s, under 13s, 14s, 15s, 16s, get in the gym, you need to lift heavy throughout all the month, etc., etc. Kind of all the reasons why they shouldn't, we've covered earlier on the webinar. So, a couple of online resources that you can go to, and my kind of favorite, not favorite one, but the easiest one to navigate and where you can get into different avenues and deep dives is She Research. That was more of a tongue twister than it should have been. So this is basically a research group that's originated in Athlone IT, which obviously, as I said, the Technological University of Shannon now. But on their website, they have different education parts, what research projects they're doing. And it's also, I think, a good um, place to see women and girls getting into science and research, and what is usually kind of a male dominated area of the world or work, that all the good work that's happening, both from a couple of my classmates have been doing research in the training load and training demands of women's sport, but also it gives kind of a pathway for girls and women to look up to and be like, oh no, women are taking charge of future research and different training protocols and different things like that. So I definitely recommend having a scan through that. On social media, I don't really have anyone in particular that I follow on social media. Again, you can kind of look on my page and kind of go through who I'm following, what is who I'd kind of recommend. But as you come across, because there's obviously going to be new people that always come out and kind of get a bit of traction and a bit of famous, what to avoid. People who use absolutes, things like anyone selling a diet tea shake, just block them, mute them straight away. They should not be allowed to be on the internet. Another one is that I see often, especially in uh, women's training and different things like that. Anyone saying that you achieve a certain result from a specific workout. So this 10 minutes to get six pack abs, or everything else that you kind of see. Certain exercise does not give you a certain result. Your Say, just for example, your arms don't know what a bicep curl is, or your biceps don't know what a bicep curl is. All they know is that I need to move my hand from here all the way up to your shoulder, back down again. Same with a squat. All your thigh muscles, hamstrings, calves, all they are worrying about is move your hips down or straighten your knees, whatever point of the squat you want to focus on. It does not know the difference per se around the difference between a leg extension, a leg press, or a squat. It just knows there's load going through the muscles and the tendons. So if anyone tells you on Instagram or someone sends you something, do this and get a result, they're just talking nonsense, and it's yeah, as I said, it's just nonsense. What does give people results is variation of training and managing training load. So again, one week you might be doing squats. Second, or about 2, 3, 4 weeks after that, you might be doing the leg press. Again, still a squat movement, using similar muscles in a slightly different way, but all your muscles know is that it needs to work and it needs to move your legs or feet up or down or whatever movement that you're doing. So hopefully that makes sense to people. So we're at the end now. If anyone wants to send any questions in, just DM me on Instagram or email me at sticktotheplan2023 at gmail.com. You will be getting, obviously, the recording of this, so just reply to that email and again, ask any questions that you want. I will be sending out a review form with content suggestions that will be sent out in the next couple of days. So if you do want to see anything from the page or from me in particular, or kind of want more research done into or another topic to talk about, just fill out that form, send it back to me. I'll have a look at it and I'll try include it or research it as best I can, and I'll pass you on the information specifically, or I'll do a page or a post on my page about whatever topic that you do want to see. And then, as I said in the email, whoever signed up to this, even if you couldn't make it tonight, you get 20% off your first coaching plan for signing up to the webinar, and it's valid until the end of the year. So even if you don't want to do coaching right now and come September, October time, oh, I did that webinar or signed up for that webinar, your first block, your first 6-week block with myself will be 20% off. And again, I can give you more details about coaching or any other questions. Again, just DM me or email me at sticktotheplan at 2023@gmail.com. Yeah, so that's pretty much it. I'll wrap it up. That's just the references there. Again, you can have a look at them yourself if you are that way inclined. But just to kind of show you is that everything that we've gone through there is backed by science, and there's obviously a lot more research to go into the female side of things. And as I said, particularly on the psychological aspect of it, much more research needs to be there. But everything's kind of getting caught up with the physiological side of things and the physical side effects of the different stages of your menstrual cycle. So again, good resource is sheresearch.ie. There's good little blogs and education, little videos on that, and it'll give you a pathway into finding out more. And obviously, fill out that review form, and any content that you do want to see, I'll do my very best to make it and hopefully inform everyone else. And if you do are half thinking, oh, should I ask that question? 99.9%, or I would actually say 100% of the time, someone else will want to ask that question, but they won't. So you're better off asking it, and it'll help way more people than you think you'll ever know. You'll be like, oh, that's a stupid question or anything. No such thing as a stupid question. just ask away and I'll help you as best I can. So yeah, that's pretty much it. I'll stop sharing my screen. And yeah, if anyone has any questions, just as I said, DM me on Instagram at stick to the plan, all underscores between the words, or email me. You can reply to the email when I send out the recording. So thanks everyone, and hopefully I plan to do doing more webinars about different topics. So let me know what you would like to hear about or talk about, and yeah, basically just stick to the plan. Thanks for signing up, and as I said, any questions, just let me know, and I'll help you from there. Thank you.